check off with me, so you won't know which one of the four. But I will set out some materials there, and you gather the materials and put it in your workstation. And I already put the bed at a comfortable height for me. And then I put the bedside table waist high, because with the sterile field you want it always waist high. And I cleared the table to where I can put the sterile drape here. Okay. Skill. So we have 3 wounds on this dummy: a Penrose one, a suture one, and a decube. All right. So I'll do the decube last. I usually have in the clinical setting, I usually use a lot of clean gloves, and then when I change gloves, because it gets dirty and it gets moist, so I use a lot of gloves. Go ahead, and for the checkoff, you start from the knock. You identify your patient, do your identifiers, make sure you're doing hand hygiene. Okay? And then first thing you ask, are you in pain? Because they have a wound, they have sutures, you have to address the pain. Okay? If they tell you there's pain, then you have to medicate the patient. It depends on a standing order from your doctor, whether the parameter is the pain is from 3 to 5, then you know the order is this. If it's more than 6, give this kind of pain medication, right? So let's say the patient said 0 out of 10 pain, so I can go ahead and proceed with my procedure. So I will start first with the dry dressing for the suture. It's a closed suture. I will get my clean gloves. Remember, I already washed my hands. And when you're checking off, you can take off your rings so it's easier for you. It's like smooth. All right. Usually I have some sort of tape here with the initial of the nurse who did the dressing before. The initial date, and there's a date and time. So I know, okay, if it's a daily dressing, I know the dressing was made before. If it's a weekly dressing, then I know when to dress the patient, because I just count 7 days after. So it will tell me when the dressing was last. So make sure when you do your checkoff, cut a piece of tape, put your initial and the date. You can put the time if you want, because there might be orders where you are doing dressing twice a day. So you want to check that you're doing it, twice a day. So I open my dressing. This is my Penrose one, and this is my suture one. Let's do the suture first. The first thing I do is look at my old dressing. You have to tell me that you looked at it, you document what you assess. The size of the exudate, the color, whether it smells, a funky smell, whatever smell it is, whatever you see here, and you can invent whatever you want. The size of the exudate, and if there's no exudate, you just tell me, okay? Because that's part of your nursing process, is you're always assessing. Okay, this one is clean gloves, and then I throw it out. I'm not gonna throw it in because I'm gonna cover it up. So you throw that away. Make sure that you have your trash nearby. Okay, this one is in the dressing change tray, so I just left it here, but pretend this is inside. Okay, there's another one. Can you grab the other one, please? All right. So I looked at the incision also, and make sure that you're assessing also the incision. What I need to do now is make sure that, you know, nothing's wrong, you know, it's not inflamed, nothing's coming out. If there's coming out, you're describing everything. So what I'm gonna do now is open up my change tray. Okay, I open it up. If this was new, you open it up by the borders. I like tape it so much. Just pretend it's new. Okay. I always whenever you have tray like this and it's sterile on the inside, this one is not sterile because I got, you know, it's resting on some supply room. I just put it there. I already cleaned my work area. It's waist high, and then I open it away from me. I open it away from me, and the first thing I see is the sterile drape. I can either touch it with my clean gloves, I can touch it with my bare hands, okay? But since I touch this, you know, wound dressing, I can go ahead and take this off and throw, I usually change my gloves because I don't know what I'm touching. And go ahead and communicate with me what you're doing, and, you know, I'd like to do a role play.
Would I get penalized if, as soon as I take it off and throw away the dressing, I take off the gloves? Would that be okay?
Yeah.
And then I could still open the container and everything, right?
Yeah, as long as you're just touching the just the border. Okay. I would do my I would clean my hands again and get another pair of gloves if I want, because you're not, you know, you're not doing the sterile field. Once you set up your sterile field, you have to stay sterile. All right, so I get my gloves again, and as I said, you can do this with the bare hands. Okay, so now the acceptable border is 1 inch. It's not 2 inches, it's 1 inch. You can only touch 1 inch of the border. If you touch more than that, then you've broken your sterile field. So just touch 1 inch of the border. Just 1 inch. Make sure you're not touching any other part, and you're not touching it to your clothes. And this one cannot be you cannot rest it here because the bottom is not sterile. Anything you drop in your sterile field needs to be touched by sterile gloves. Okay, sterile to sterile. Now, if I touch this, this is the border. What I can do is just drop everything there. So I can use this tray, and I'll tell you why. So I have everything there. So I've looked at I've looked at the wound. Now I have to clean the wound, right? So the change tray doesn't have a sterile gloves. So I get my sterile gloves. I can, you know, discard this, but I'm gonna use that again. So make sure you're only touching the border, and make sure this one is not touching that one. Okay. That's why it's very hard if you have new stuff, and then it's very hard to control. So go ahead and practice with your old gloves. And you've learned that you can touch only the inside that's touching the bare skin, right?
And it's okay
and
that
just,
this is touching? Yeah.
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 Because I've thrown my, and just tap it, and then this one is discard. And then you just do sterile to sterile. You put it in the pocket. You don't touch this one with the sterile gloves. Okay, you just look for that pocket and then snap. All right, now I can touch my sterile field. Now, if this were medicated with betadine, then I can use this. So if this were medicated with chlorhexidine or betadine, what I'm looking for is that, okay, if this one is medicated and you swipe from top to bottom, you have to discard. Okay, I'm using that again, sorry. And then don't forget to clean the outside too, not just the wound itself, discard. Clean the outside and then discard. All right, that's your. And if they're allergic to betadine, and this is betadine, then make sure that you also have this on hand, because then you're not going to use. And if the swab stick is not medicated, then that's a different scenario. I'm just using this if this is already medicated. So, for example, so let me put this back.
What if the wound was much bigger and you needed more swabs?
You kind of, during the shift report, you already, the nurse.
Oh, you would know
You
how
would
much
know,
you need.
yes.
Okay.
This one is for a smaller wound, so they only have like 3. You can clean as much as you can, and I'll give you another alternative with that. You already dumped everything here, right? For example, you don't have this, or it's not medicated, but you have this. You look at it. Oh, it's not expired, so you can still use it. If it's unopened, that's fine, but you have to label it with your initial and when it was opened. Okay? And the time. Why? This is only good once it's open, good for 24 hours. So you tell me during checkoff, okay, it's not expired, and you see the label, and it's still good because it's still within 24 hours. So for sterile technique, once I open this one, do I set it up on the table like this?
No.
No. You want to stay sterile, so you set it on the table like this. Do I set it on the table here? No, because this is not sterile. You just got this from the supply room. So the next thing you do, so it's within 24 hours, so you can still use this, is what you call lipping the bottle. You lip it away from the label. You don't want to lip it with the label because the liquid might drip on the label and also on the tape where you put your initials, and it might erase some words or something, and then you don't know whether it's within 24 hours. So you lip it away from the label, and it's also cleaning the opening, so that's what you use here. Okay, and don't make any splatters, because the splatter might contaminate your work area. So make sure you are containing the the normal saline within the tray. And this one you don't need anymore. So, and you can put as much as you like here for when you're doing your, in a clinical setting. It depends on how much gauze you need. All right. So for example, I need more gauze because there's not a lot of gauze here. So what I can do is, remember your border. I can open this up and just drop it on my sterile field. This is sterile. Don't use anything that's already open. Use something that's sealed. Okay, so the one thing I need to do now is that do my sterile field now. This is the other scenario, right? Where you don't have swab sticks, the swab stick is not medicated, blah, blah, blah. So go ahead and do your sterile gloving again. Okay, so let me, for the purposes, I put my sterile gloves, right? But you don't do this. You do good sterile gloves. Okay. So once I have the sterile gloves on, I can touch anything in the sterile field, right? So you can do this in so many ways. If this is just a swab stick, you can just dip your swab stick here and then do the same thing. Clean and then discard. All right? Clean and then discard. And so on and so forth.
Do you want us to do the outsides of the wound first and then the inside? Do you like the order of how we clean it? Is it the outsides of the wound first and then the inside?
I would do the
Isn't it
this one
Inside first and then
I would do
outside?
the
Okay.
outside from the inner. Now, if you don't have the swab sticks, go ahead and you can throw your gauze there. So, you know, you have a lot of gauze that you threw here, okay? And then wring out the moisture. Remember, everything here is sterile. And then the same thing, like the swab stick. Clean, discard. And then, you know, get another gauze. You usually have lots of gauze, you know, soaked there. And just get, you know, as many gauze. Clean and then gauze. Clean and then discard. Okay? So let me discard.
Are your gloves
Wouldn't
still
you?
sterile while
Yeah.
you're doing
Yeah, I'm still sterile.
it? Even though you just touched
You just touched the wound.
You just touched the wound.
Yeah, it's okay.
Yeah.
Yeah, it's okay. Because I didn't touch it twice. I only touched it
She
once.
swipes once.
And then, remember, you're touching it with this one.
Are you using both hands or just one hand to clean and the other one to grab the gauze?
I'm just cleaning it, so it doesn't really matter
Doesn't
what
matter.
what hand. I'm dominant,
Mhm.
and this is like close suture, so I'm just cleaning it. Okay, so you're not actually there's nothing there. It's just a close
If you
suture.
want to
So
get technical, I mean, this is more of a clean procedure kind of than, I mean, you're using sterile stuff, but it's not sterile like
Mm.
surgery.
so
you know?
you're cleaning it with the gauze thing. If you don't have the swabs, you clean it, but then you have to discard it. All right, but you have a lot of gauze here. It's already soaking, so I'm not like, you know, I don't have a lot of gauze in there, but a lot of soaking, and you're just wringing it out, and then as long as you're discarding, okay? So you're still sterile because anything that you touch here is still sterile, and then you're just wringing out the water, okay? So now this is wet. What do? Now you get your wet gauze and dry it, but you have to throw it again.
Dry gauze or wet gauze?
Dry.
Okay.
You don't want to macerate the skin, so you want this as dry as possible. And then get a new one, dry, throw. Get a new one, dry, throw. All right? So that's what you do. And now you're ready to close it. Okay? What I would do for this, I don't have a lot of gauze. I would still put gauze here, and then my ABD pad, just so you're not touching, you know, it's super absorbent. You can break the sterile field at this point. Okay, you can break the sterile field because it's already covered. Why? Because if you have a change tray in your tray, especially this one only has the plastic tape. What if your patient is allergic to the plastic tape, but you got the paper tape from the supply room? But this was, let's say this, you have the plastic tape, but this one you got from the supply room. So this one you can do clean gloving. And you have to tape all around. You can tape here, you can tape there, you can tape there. Once you tape all around, you can tape across or whatever. But you have to put your initials here again and put the date when you did the dressing. Now, any questions on the?
Can we write on the tape while it's on the patient, or do you want us to
No,
write
you don't
while
want.
it's off?
No, you
Okay.
don't want to do that because your point might be.
Oh.
You want to prepare a tape beforehand, and you're not in a rush because you already closed everything. So just get